My name is Debbie Beckford. I am from the Caribbean island of Trinidad. I've been living in this country for over 25 years, so I guess I'm telling my age when I say that. Congratulations on becoming the 44th President of the United States of America. One of the things that we have in common, you and I, is that we both have 10-year-olds. My daughter was born on July 10th, and I believe your daughter was born on July as well. So we both have cancer kids in a good way. One of the things that I wanted to talk about was the stimulus package, and I am in total agreement and fully support you in terms of signing legislation for the stimulus package. One of the things I was thinking about today, because, you know, I work down in the Wall Street area, and this is what most people are talking about, is how the homeowners are going to be helped by the stimulus package. And one of the thoughts that I had was that perhaps the stimulus package should probably be broken into three categories, or have, you know, three forms done in which people could participate. The first priority, I think, should be given to homeowners who paid their mortgages on time and through no fault of their own. These are people who obviously bought homes that they could afford and through no fault of their own recently became unemployed. So they would probably be like at the top of my priority list. I don't agree with people who paid enormous amounts of money for homes that they couldn't afford. However, I guess in balance they should be helped as well, and so they should probably fall second on the list. But definitely a priority should be given to the people who played by the rules, who bought homes long ago. And I additionally think that the principal should be slashed as well. You know, even though people's homes were valued at $600,000, and it turns out now that their homes are now valued at probably $300,000 or $400,000, it certainly is a way that could be helped, and I think that's going to help tremendously. So that's my little input, and that's what I have to say. Hi to Michelle and the girls.
My name is Betty Scott. I'm from Flushing, Queens, in the state of New York. President Obama, first of all, I congratulate you for the great effort that you are making to save this country. We all have to do our part. One of the big things that I'm really concerned about is this. I was a volunteer at Mary Immaculate Hospital. I said was, because as of today, it has been closed by the state, and also St. John Hospital has been closed. Great effort by the staff of Mary Immaculate, especially Dr. James Satterfield, to save the hospital was made, but to no avail, unfortunately. The impact of closing this hospital is immeasurable from the top down. The doctors, especially young doctors from the Caribbean, from Southeast Asia, who were not able to get into bigger hospitals, but were privileged to have the technical and skill given to them by Dr. Satterfield and his staff. It is really a terrible waste for these young people to no longer have a place to learn. There was a nursing home there as well, and all of these patients had to be moved to other facilities. Sister Noreen, who was the head of the volunteers, called me yesterday morning to tell me how sad it was for all these patients who had to lose a home again. They had choices to go to different homes, But if there were no beds there, they had to go wherever a bed was available. All of the programs, the cancer treatment program, the clinics, the drug treatment programs, all dismantled, all patients having to be shifted elsewhere. The capacity of the Queens hospitals is now shortened, and people who need care, it's going to take longer for them to get care. So this is one of the big concerns, trying to save the hospitals and provide care for people who are in the lower socioeconomic strata, who only have Medicaid. And Medicaid does not reimburse the hospitals enough. And that is something really that I think your administration needs to look into. It's not only upgrading medical records to the new technology, but also upgrading what it costs to run a hospital that's in a low socioeconomic area.
My name is Marva Straight. I'm from Queens, New York. Okay. First, I want to say congratulations to you, Mr. Obama, the 44th President of the United States. I am a licensed clinical social worker and a naturalized immigrant who appreciate being in this country. This country was built by immigrants, and I want to speak to that issue, the immigration issue. In New York, we have millions of undocumented or illegal immigrants. People who have left their homes, their families, to make a better life for themselves. People who are hardworking and ambitious. People who are longing to be a part of society, who believe in the American dream. We need to start this process, and we need to start this process as soon as possible. Some form of amnesty, some type of work program to help the immigrants. Thank you.
Again, on behalf of Harris 8 Productions and Talk to the President Web.tv, we thank you for your encouragement, and we look forward to serving you and helping you in your battle to help solve this crisis in this country. We thank you.